So, my name is Romel Paulo Matutina, and I will be your nurse for today. So, may I know your name, ma'am, please?
Naime Rokchari.
So, okay, very good. So, is it okay to you, ma'am, to ask some few questions?
Yes.
Okay. So, first question po, ma'am. So, have you ever experienced recent changes in hearing po?
No.
So, okay. How about ear discharge po?
No.
How about ear pain? Sumasakit po ba ang tenga niyo?
No.
How about ringing or cracking in ears po?
No.
So, okay. In your past history about naman, ma'am. So, any previous ear or hearing problems, ma'am, such as infections po, earaches po, ma'am, mga ganyan po.
No.
Okay? How about naman po sa inyong family history po? In history of history of sickness po. Is there any of your family who has ear problems, ma'am, or ear loss, hearing loss?
No.
So, okay. So, in your lifestyle and practices, ma'am, have you ever use of ear protection from noise, ma'am?
Yes.
So, okay, very good. So, ma'am, now we are now done on the I am now done on the asking some questions. So, I will now proceed on the physical assessment, ma'am.
Okay.
Okay. So, first, inspect the auricle, tragus, and double for size, shape, position, lesion, discoloration, and discharge of the ears of the patient. So, we will now observe your ears, ma'am. So, inspect lang po muna. So, okay. Okay, on the other side po. Okay. So, I don't see any lesion. The shape is normal. And I don't see any discoloration ulit. And any discharge, I don't see. I don't see any abnormalities. So, next is palpate the auricle and mastoid process for tenderness. So, we are now palpating your mastoid in the ear. So, okay. Okay, on the other side. Okay. So, while palpating the mastoid and auricle of the patient, so I don't see any tenderness or any abnormalities on the mastoid of the patient. So, and next, we are now going to the otoscope examination. So, inspect the external auditory canal with otoscope. So, we have here, assuming that this will be our otoscope. Um, okay. Otoscope for discharge, color, consistency of Karaman, color and consistency of canal walls, and for any nodules. So, assuming that this will be our otoscope. So, ma'am. So, okay. We will now use our tip of the finger to para parang stand kasi ang importance of this halimbawa bata ang pasyente mo pag naggumanon siya matutusok siya ng tip nito, so always na nakaganyan yung finger, yung hililiit para ma-rest kung sakaling gumanon yung pasyente, lalo na yung bata, what if kung bata ganon, hindi siya matutusok nitong tip ng otoscope. So, the importance of this is this. So, okay. Can you please? So, using our right hand, we will now hold the left ear. And, dahan-dahan natin siya observe. Okay. Be careful na hindi natin masyadong mailalim yung ng otoscope, itong tip ng otoscope sa kanyang tenga. Just carefully and not too deep. Okay. Okay. Next po. Now we will pull the patient. Okay. Okay. So for inspecting the external auditory canal of the patient, I don't see any discharge. The color is normal. I don't see also any consistency, and of the, and the current, the color is normal. I don't see any consistency. The canal walls are no nodules or any abnormalities in the auditory canal of the patient. So next, inspect the tympanic membrane using the otoscope. So using again the otoscope for color and shape, consistency, and any landmarks. So, okay ma'am, ulit po. We will now observe your tympanic membrane. Okay, po. We will now pull the ear of the patient, and be careful na hindi masyadong maibaon yung tip ng otoscope. So, okay. So, while inspecting the tympanic membrane of the patient, I don't see any consistency, landmarks, or any abnormalities. The color is normal. The shape is normal again. I don't see any abnormalities of the tympanic membrane of the patient. So, okay. And next, have the client perform the Velsa maneuver and observe the center of the tympanic membrane for flutter. Tapos, we will now observe the tympanic membrane. So, ma'am, again, ma'am. Okay, ma'am, can you perform the Velsa maneuver? Okay, next. On the other side po. Okay. So next, we are now going to the hearing equilibrium test. So first, perform the whisper test by having the client place a finger on the targus, so is our targus, on one ear, and place the two syllable words. Magsabi ka ng kahit anong words sa patient with 30.9 to 60.9 centimeters or 1 to 2 feet behind the client. So, and repeat on the other ear. So, okay. So, okay, ma'am. Talikod ka po, ma'am. Then, takpan mo po ang targets mo sa, ito po, ma'am, is ganito. And sabihin mo po ang i-whisper ko if narinig niyo po. So, okay? Okay, assuming that we are on the 1 feet or to 2 feet. So, nursing.
Nursing.
Again, ma'am, can you louder po, ma'am?
Nursing.
Okay, on the other ear po. Okay. Teacher.
Teacher.
So, okay, very good. So, okay na po, ma'am. Pwede ka na po matap. And next, we will now perform the Weber's test by using the tuning fork placed on the center of the head or forehead and ask whether the client hears the sound better in one ear or the same in both ears. So, here's our tuning fork. So here's our tuning fork. And to activate the tuning fork, we will now do this, or we will just papatama natin siya sa ating knees. Activate the sound. So we are now going to perform the Weber's test. So ma'am, can you please tell me kung saan po mas ano yung tunog? So ma'am, where's better po? Narinig mo po?
Mid po, both ears.
Okay, so this is normal. Okay po. So now, we will now proceed to the Raynaud's test. So now, we are now going to perform the Raynaud's test by using our tuning fork again and placing the base on the client's mastoid process. When the client no longer hears the sound, note the time interval and move in front of the external ear. When the client no longer hears the sound, note the time interval. So, okay, we are now going to the procedure. So, the mastoid process is located on there. So, okay. So, where did the sound best? So,
Second.
okay, on the left here. Okay. So, where the sound best?
Second.
Okay. So now, we're now going to perform the Romberg test to evaluate equilibrium with feet together, and arms on the side, and close eyes for 20 seconds. And I will observe the patient for for kung nagsisway ba siya or na parang na out of balance. So, okay, we will now proceed to the procedure. So, okay ma'am, can you please stand up po? And stand straight po and arms nakaganyan lang po. And face forward po. And I will observe you for 20 seconds. Okay? So, assuming that 20 seconds. So, okay ma'am, we will now repeat the ano. But this time ma'am, you can close your eyes po, please. Okay, just stand straight po. So, okay. Assuming that there will 20 seconds. So, okay, can you sit down na po? So now, we are now done on the hearing and equilibrium test. So, after that, we are now going to analysis of the data. So, formulate the nursing diagnosis and formulate corroborative problems and make any necessary referrals if meron. So, that's all. Thank you.